Let's take you to the story now. KFC Add Hope has partnered with humanitarian aid organization Gift of the Givers to spread some extra hope to those that need it most over the festive season. This additional relief is over and above both organizations' current programs and will focus on some of the remotest areas. Earlier this month, the South African Human Rights Commission found that at least 116 children died of severe acute malnutrition between 2021 and 2022 in the Eastern Cape. Now, let's discuss this further. We're now joined via Teams by Ali Sablay, Gift of the Givers, a Western Cape project manager. Ali, thank you so much for your time this afternoon. Just talk to us about how far this partnership with Add Hope will go in addressing hunger in this country, hunger issues in this country.
Thank you so much. The real crisis started during the COVID-19 pandemic. As we've seen the increase in the numbers of COVID patients dying, we saw hunger alleviation increasing at a rapid rate. Hunger came up more in the forefront when we visited rural areas and families informed us the last time they had a meal. We found children coming to school, and when they get to school in the morning, during the lesson, they passed out. Further investigation found that these children, when it's a weekend especially, they go home on Friday from the school. When they come back on Monday morning, we then found out the last meal they had was on the Friday afternoon when they've last been in school. We then got appeals from clinics in the Northern Cape who informed us that they have the medication to treat HIV and TB patients, but they cannot give the medication to them. We then found it strange. We then found out that many of these people have no meals to take when taking this medication. And with the partnership with KFC Add Hope, they came as a lifeline. We managed to set up many feeding schemes in many of the areas that are in the rural areas, into schools, clinics, and just setting up feeding centers to assist communities during this malnutrition period. As you correctly said at the beginning, the core focus this year, which came as a shock to everyone, when a mother took the lives of her 3 children due of the hunger situation in the house. Our teams did a further investigation in the community, and speaking to the clinic sister, he says every time a child or a mother comes to the clinic and he finds nothing wrong to them, and he sees it's only hunger, but the most painful thing for him was there is no medication for hunger. The most painful thing for him was turning that mother and child away, knowing if no help comes to them, they can pass out or it can be death at any moment. So with this partnership, we are extending it throughout the festive period, and we are with this as well, we will be assisting those communities who doesn't have the joy of feeding the festive period or going hungry during this festive period. We are making sure they have a meal during this period.
Now, Ali, I mean, some of those stories that you tell, we know plenty of them. I mean, just the other day we saw a television expose also in the Eastern Cape where a mother had to unfortunately breastfeed her child, knowing very well that she has HIV, but the child was hungry. We also saw a family, through a report done by our colleagues in the Eastern Cape where they were hunting for monkeys, something that they had been doing for months because there's no other source of food that they could eat. So these stories are harrowing. And when you look at the statistics, I mean, more than 500,000 households with children under the age of 5 years or younger reportedly experienced hunger in 2021, and some children under the age of 5 are dying. So when we talk about the concerted efforts that come from particularly private entities, I mean, how much work would you need to be able to eradicate the situation? Of course, we know that we are not in isolation. We know that this is a problem the world over. But we also appreciate that there are departments within government that are tasked to make sure that no child goes hungry.
Most definitely. The more support we get, the further we can reach out. And with the KFC Add Hope campaign, their main focus was to ensure a child in a rural area does have the same joy and the same livelihood as the child staying in other parts of the country. And as you correctly said at the beginning, just to inform you today, the mother that was feeding her child, the mother that was HIV positive and was forced to give the child breast milk because there was nothing else to give the child, and in that way made the child HIV positive. Today, our teams delivered a supply of baby formula as well as Genesis easy peanut butter paste to that clinic to assist that clinic with hunger alleviation. And with KFC, we've managed to set up many feeding schemes in location that was earmarked as malnutrition hotspots, especially in the Eastern Cape. We find there's a huge problem with malnutrition in the Eastern Cape. So far, 116 deaths for the year. And as you correctly said, your colleagues going into the community and finding children hunting down monkeys. I can relate personally to an incident where a mother came to me after we did a delivery of some food hampers, where a mother personally came to us and she informed us, "I'd just like to thank you for this donation. This is my 3 children. You can ask them the taste of every plant in the bush." That was what we were surviving on for the last 3 to 4 days. And then as well, when we went into an area like Willemore and Rietbron, the social development sister informed us there are children here hunting down tortoises, in some areas other forms of animals, just to provide for their families. And during the festive period, we notice, especially on the N1, when it's the holiday period, we find many children going on the N1, scratching in the big garages or along the bins. We then did the inquiry, and they informed us their parents had nothing to provide them, and their parents encourages them to go scratch in these bins because they know this time is a tourist time when many tourists will come into the different parts of the country, and they're most likely to find food in those rubbish bins.
Now, you mentioned, Ali, that you will be going to some of the remotest areas in the country. Just talk us through your festive season plan. Where are you hoping to do, where are you hoping to help, first of all? And is it enough that you have? I mean, I was speaking to your colleague a couple of months ago, and she was telling us in the Eastern Cape alone, I think they had spent in one particular year just on food parcels around 35 million rands.
It's never enough. The situation in the country is devastating, especially in terms of hunger, where there are many other towns still reaching to us. But what we've done, we've identified with the Social Development Department, with community leaders, most importantly, with clinic sisters and hospitals, we identified the key hot areas. We had a meeting with some principals and teachers from the various areas. So our operation will extend into the Eastern Cape, parts of the Northern Cape, and the most rural parts of the Western Cape. We have feeding centers set up in Gauteng and KZN as well that will see to the needs of the kids during this festive period. And for those children, there are 2 schools in Cape Town where one is the deaf school, one is the blind school, where it's dedicated for children from the rural areas of the Northern Cape and Eastern Cape. And with the support of the KFC Add Hope, when school closes on the 12th of December, the teaching staff reached out to us. They were quite worried about the well-being of these learners. So when these learners go back home on the 12th of December, we will be providing them with food hampers to assist them for a month to carry them through the festive period until they come back to school.
All right, Ali, thank you so much for your time this afternoon. And of course, thank you for what you do as an organization. That is Ali Sablay, Gift of the Givers, Western Cape Project Manager.